to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Bruce Campbell. He's an otolaryngologist and is the author of the book, A Fullness of Uncertain Significance, Stories of Surgery, Clarity, and Grace. There's an excerpt from that book on Kevin MD titled Mom's New Pacemaker, A Story. Bruce, welcome to the show.
Thank you, Kevin. Great to see you.
So we'll get into your book and excerpt in a little bit, but first off, can you share your story and journey to where you are today?
So I started working in a hospital when I was about 15 as a volunteer initially, and I was an orderly in an emergency room and operating rooms back in the Chicago area where I grew up. And so that kind of let me see medicine from all sorts of different perspectives. The surly surgeon from the perspective of the emergency room orderly, and as all my time through medical school and then residency and finally fellowship, just lots and lots of stories. And that's one of the things about medicine that's been such a fascinating thing to me, is that we are completely encased in stories constantly. And it's just a matter of finding the time to pick through and find the ones that are most inspirational to us. And that's been the journey that I've been on through a 45-year career in medicine, with living the dream, really, and gathering stories along the way.
As you reflect on your decades-long career in otolaryngology, what would you say are some of the biggest changes over those decades?
That's wonderful. My practice is almost entirely cancer, head and neck surgery. But as I've watched within the specialty, our ability to make diagnosis is so incredibly changed with the advent of imaging. When I started, we just basically had head CTs, and that was about it for digital imaging. And the advent of MRs and PET scans and all of the functional scanning has been really amazing. In my world of head and neck surgery, the ability to do reconstruction with microvascular techniques has really been a game changer. And now with the advent of robotics and endoscopic procedures, just being able to do very precise surgical procedures in ways that we really couldn't do back in the 70s. And there's been a huge paradigm shift in how cancer is treated. When I was in training, we were doing laryngectomy about once a week. And we don't do laryngectomies very often anymore, except in salvage situations, because of the advent of much improved radiation treatments with image-guided treatments, as well as the combinations of much improved chemotherapy and targeted therapies has been a game changer for our patients in survival and quality of life. And it's been a lot of fun to watch that happen, because having the perspective of seeing how some of our patients just suffered so terribly, even if they were cured years ago, that the quality of life side effects were so awful. But now we can really do a much better job with managing the cancers, as well as helping patients survive and thrive afterwards.
And again, from your perspective as an otolaryngologist, what would you say are some of the remaining challenges or some of the biggest challenges facing your field?
In the cancer world, the problem with all cancer trials is that the interval from an initial idea to the final results from a big phase 3 randomized clinical trial can be 7 to 10 years. And in the meantime, there's been so much progress in the molecular biology, as well as just the management of cancer, and so few patients entered on trials that we really don't optimize our ability to care for these patients or provide them the best, most cost-effective and most effective treatments. So I would love to see ways that we get more patients involved in trials, as well as find better ways to use the treatments that we have to find ways to help people. I think the technology will continue to expand, and technology tends to find a use, even if it's not always the best way to do things. And I think finding better ways to focus this expensive and difficult to learn technology on patient care is going to be relevant. My son is actually an otolaryngology graduate who's currently doing a fellowship, and his practice will be quite different 40 years from now than my practice was 40 years ago. So it's fun to watch that transition time.
All right, so let's transition to your excerpt in the book. Once again, your book is titled A Fullness of Uncertain Significance, Stories of Surgery, Clarity, and Grace. And there's an excerpt from that book on Kevin MD titled Mom's New Pacemaker, A Story. Now, Bruce, for those of you who get a chance to read your excerpt, can you just walk my audience through it and share the story of why you decided to write that particular one?
So in writing in medicine, some writing is very difficult and trying and stressful, and some of it's just a lot of fun. And this was a piece that was actually a personal experience. Several years ago, my mother was in a hospital a couple hours away from where I was living at the time, and she needed a pacemaker. So I went down to be with her as she had the experience. She stayed overnight, and the next morning, the nurse practitioner from the cardiologist came in to give us a demonstration of, how she would take care of the incision and the things to watch out for. Handed us a brochure that said all the different things that she needed to watch out for. And it's very practical experience. But basically, when you have a pacemaker, they tell you, don't use a stun gun, don't use a jackhammer, avoid high voltage equipment, to be careful around high powered motors, and my mom was 90 years old at the time, quite frail, but lively. And we really had quite a conversation. And I stressed to her, I did not want to find out that she had become a lumberjack or, a police officer, because it was just too dangerous for her at the time because of the potential damage to her pacemaker. And we carried that through, and she really lived a much better quality of life because of the pacemaker of her final years. But we actually had lots of fun talking about the things that were on that list that she needed to avoid.
So tell me, as a physician yourself, going with your mom, tell me a little bit about that experience.
Well, I have to say that the one thing I remember most about that was that the cardiologist actually never came in to speak to us after she had her procedure done. And that is something that I have talked to my own residents and students about, is there is nothing as important after you've done a procedure, after you've billed somebody, after you're going to collect money from their insurance company to do something, that you must make that personal connection. And that's just one of those experiences that stuck with me, that we certainly got lovely care from the nurse practitioner, but the woman, the cardiologist who actually put the pacemaker in, never touched base with us afterwards. So that procedure was done in the hospital where I'd spent years working as an orderly and as a volunteer. I knew the people there, and it just felt a little disrespectful not to have that moment with the cardiologist. But that said, everything went fine, and she did just great.
Your book is a collection of many of these stories, and you've contributed so many stories on Kevin MD for the past many years. So how do you go about collecting, remembering, and deciding which stories to include in your book?
So as a writer, and I don't really view myself much as a writer, more of a physician who just happens to be around stories, I tend to write about things that just really grab my attention for the moment, make me, sort of stop and go, what just happened there? And those are the things that I'll jot down a note here, or maybe I'll put something in my journal or put it on a note card, stick in my pocket. And I may or may go back and write about it later on. I've been fortunate to have places to share my stories. I was able to have a blog on the hospital's website. You've been kind to share some of my stories over the years, and I've got my own website now. And just, I feel that, having the chance to write the stories out and share them has been a gift and a joy to me. And people have been very nice and responsive to the writing. So when a story kind of catches me, I'll go home and I begin writing about it, and I never really know what direction the story is going to take once I start writing and editing. But then I get to the end of it, I whittle it down to its bones, and then I'll put it out and just see where it goes. And I've got 200 or 300 of those things that have happened over the years. I was fortunate enough to have the opportunity to compile about 60 of them into this book collection, and that's where we are now. There are ones that probably caught my attention the most. There are others that one of these days maybe they'll see the light of day as well. But it's just been a great joy to have this as a way to reflect and to remember and to celebrate and validate some of the experiences I've had over the years as a physician.
Are there any common themes that run through the stories that you included in your book?
No, maybe what an idiot I can be. I mean, I think that's, in medicine, we've been told that there's a hierarchy and the physicians are at the pinnacle of that, and everyone else is trying to do us damage and harm. And I found that, I learned so much from my patients. I learned from the nursing staff. I learned from my students. There's always a moment where I can get more insight into my own weaknesses and failings. And I actually wrote out a complete story about a terrible mistake that I made several years ago. And I contacted the family, which to me is very healing personally. They were not interested in having me share that story, but I did reflect on it. And there's actually one of the stories in one of the essays in the book is a bit of a reflection on that experience. So we are not perfect, and those things that cause us, moral injury are real, but writing about them has actually been helpful to me. And I think it's also helpful to others.
Did you have a background in writing prior to writing all those blog posts? Because I'm sure a lot of physicians do want to share their stories, but may not be able to articulate it on the computer or on paper.
No, I really didn't. I liked writing when I was in high school, but I was a biology, chemistry, major in college. And, the only creative writing you do between graduating college and graduating medical school is two personal statements. And those are opportunities for me to do a little writing. The writing came just sort of accidentally over the years. So I guess I did the book partly just to show that anybody can do this. And I would encourage other physicians to take this on as well. I mean, I always start writing. I never know where an essay is going to end up, and I always learn something in the process. And that to me has been healing. So I guess I would encourage people to give it a go because, I'm not a great writer, but I love it. And if you find that you enjoy it as much as I've enjoyed it, you'll probably have a book at the end of your experience as well.
We're talking to Bruce Campbell. He's an otolaryngologist, and he's the author of the book, A Fullness of Uncertain Significance, Stories of Surgery, Clarity, and Grace. Now, for those clinicians and medical students who read your book, what would you say are some of the biggest lessons that your book can share?
Well, I hope what they take away is that medicine it's a hierarchy in a sense that there has to be a leader of a team, but the teams are multidisciplinary. And I've tried to point that out as any opportunity I had, that I've learned so much from others along the way. And I've also learned that the narrative is a critical piece to every patient encounter. We are taught to go in and nail down a history of present illness and, the chief complaint and those kinds of things. But stories emerge if the first question you ask when you see a patient, tell me your story, you get a much different response than if the first question you have is which ear hurts, right? So I try and help students understand that it's gathering the story that tells us more about the patient within the context of his or her illness and suffering. And then our job is actually to accompany that patient. So we pay attention to their suffering. We learn to represent that suffering either in a progress note or in an ability to tell the story back to the patient so they know that we understand what they're going through. And then we affiliate with the patient, and we are charged with making their suffering disappear as we accompany them. And those are the things so the precepts of narrative medicine are the things that can drive a clinical practice or a training program in a way that will help students and residents become better physicians that are more compassionate and caring.
And my final question, what are some of your take-home messages that you want to leave with the Kevin MD audience?
Oh, gosh. First of all, everyone should send an essay to Kevin, because I think you will be amazed at the responses you will get from people who read. It's a wonderful community, and I've been pleased to be part of it. It doesn't have to be writing. It can be anything creative. It is so healing for physicians. And those that I've worked with who have had the opportunity to write or paint or do sculpture or poetry or any sort of the creative arts, or even just take time out to read, a solid piece of literary fiction, all of those things can be healing and make us better physicians, because we learn to listen to ourselves as well as we learn to listen to our patients.
Bruce, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you so much, Kevin. It's a great honor. Thanks.